like to say a big thank you to all of you who have made your time and presence available for this very important symposium, a 2-day symposium that you are all going to participate in. So thank you very much, and indeed a very good morning and a big Nisambula Vinaka to you all, those that have traveled around Suva and those that have made their way out of Suva to be here this morning with us. Thank you very much, and on behalf of the Ministry, I would like to say thank you for your partnership with the Ministry. I know we have a partnership with Lifeline, but for all those other partners that are present in the room, thank you for partnering with the Fijian government to bring to light this very important topic of discussions that you are going to be engaged in the next 2 days. I will try to keep my address very short because I believe you are the experts in this field and you have a lot to discuss. And I look forward to the outcomes of your 2-day workshop. So ladies and gentlemen, the topic as mentioned needs no introduction as it affects the lives of many families, many individuals on a daily basis. And we see the devastating impacts when we read or hear in the daily media about innocent lives being lost through suicide. And it's indeed truly heartbreaking to know that precious lives have been lost to suicide, and these lives could have been lost with early interventions, and I believe that's the way forward now. And the issue of suicide continues to plague our society on a daily basis. As mentioned, addressing this issue needs a collaborative approach. Any one institution or individual or government or anybody cannot address it alone. It needs the support. One of the biggest support that is needed to address this issue is probably from my ministry, that is the Ministry of Health. Government support is very vital to addressing these issues. Non-government organizations, faith-based organizations, families, communities, and all individuals need to work together to remove the very stigma associated with depression, and we need to create more awareness and discussion so that people are more confident and people can confidently talk about the issue and seek assistance to change their lives for better. As such, ladies and gentlemen, we all have gathered here today to discuss ways to collaborate to address on issues that many choose to remain silent about. And I think that's the biggest risk factor, when people choose to be silent. You will also note the theme of this year's World Health Day, depression, let's talk about it. And that's the way to break the silence when we talk about it. And we launched this within the Ministry of Health last week. And it is for this reason why this National Suicide Prevention Symposium is much welcomed and needed. Often people think that people who are depressed are suicidal. And I think we all think people who commit suicide are the ones who have been depressed. And I believe that is not completely true. Whilst people with depression are most vulnerable to suicide, I think they are not the only ones who attempt suicide. The key fact being anybody can be suicidal, and therefore the situation lies in every one of us, and it is within our reach, and suicide prevention thus becomes everybody's business. I have been informed by Lifeline Fiji that there are more than 27 organizations represented in this room. So thank you and congratulations once again for being part of this very important symposium. And Dr. Nirvana, I was scanning the room to see where the lead lady is. So thank you for joining us. Ladies and gentlemen, in addition, we have 2 guests from Australia and New Zealand who have come all the way to join us to share their lesson learned. And I'm sure that the symposium will generate a lot of discussions, ideas, experience and information sharing, and enhance the way forward and formulate more effective strategies for suicide prevention. 2013 and to 2015 showed us an average loss of 242 lives to suicide. And I'm sure our colleagues from the police department will be sharing more statistics with you. Ladies and gentlemen, the figure itself indicates the urgency of all stakeholders pulling our efforts, our resources, our ideas together to tackle this very issue. And it is for this reason the Ministry of Health has gladly supported Lifeline Fiji in its effort to organize this symposium and in the endeavors to raise awareness on suicide prevention. The Ministry of Health, through the National Committee of Suicide, works with stakeholders such as government ministries, non-government organizations, and as I mentioned, faith-based organizations and community groups. We as a government, as a ministry, remain committed to continue this fight against suicide and promote our collective message, life is for living. As we prepare to commemorate the World Health Day, the Ministry would like to request everyone to show their support for the theme, Depression, Let's Talk About It. And addressing an issue such as depression is critical now more than ever. We need to increase awareness, we need to increase our reach out to those who may be suffering silently, and we need to let them know that they are not alone, and that there is assistance available, there are platforms through which people can seek help. At this juncture, ladies and gentlemen, I'd like to appeal to all those who may be listening to this message to please reach out and assist anyone whom you know is going through depression and needs advice. Do the right thing, help us help those who need assistance to restore peace and happiness that each and every human being is entitled to. Let's start by talking about this issue within your families, within your peer groups, within your communities, and especially as leaders of your organizations, as leaders within groups. We have an important role in terms of raising awareness and, again, removing the stigma associated with depression, and that suicide is preventable and that life is for living. At this juncture, ladies and gentlemen, I'd also like to take the opportunity to commend and encourage organizations to take the opportunity to applaud and encourage Lifeline Fiji, namely Youth Champs for Mental Health, Medical Services Pacific, and Empower Pacific, and all others for the continued persistence in addressing this issue. I think the word persistence is very important. We need to be consistent in our messaging, and we need to be persistent in our aim to go forward. So thank you all, and like I said, the government, through the Ministry of Health and Medical Services, will continue to support you in whichever way we can, to ensure that we are able to increase our awareness and make a positive impact in our communities on the issue of suicide prevention. I wish everyone, especially Lifeline Fiji, and all the participants present, the best in your deliberations over the 2 days, and look forward to seeing more partnerships in future to address this issue. Ladies and gentlemen, also in line with the theme for World Mental Health Day, I encourage every individual present to talk about this issue. We need to talk so that we can break the silences. We need to address this issue with urgency and converge this symposium. Let's maximize this opportunity to network and strengthen partnerships to see the best way forward in tackling suicide. And I think we need to be more visible in these issues. So the march on Friday, I'd like to encourage all of you to, I see a lot of smiling faces here. I think we are looking at a big, sort of a huge support from your organizations for the march on Friday. Please encourage your colleagues and those around you, your communities, to come forward and let's take the streets of Suva by storm. We need people to see what's being done, okay? And what better way to kickstart the celebrations for the World Health Day by taking the streets of Suva, and I'm sure all the other districts will also do the same. And not only do we need to stop the traffic, we need to stop sort of the minds of people and make them notice us. And then I think we will be able to fulfill the cause on that. Let's break the silence, and I look forward for all your support on Friday during our celebrations. And once again, I'd like to press on the message. Something's happening somewhere. Or maybe it's my signal to stop. I'll just cut it very short. So once again, ladies and gentlemen, thank you for being here, and let's all take an active role, an active part in trying to spread the message that suicide can be prevented. You and I have a role to play, and I think as a government we have a bigger role to play. And like I've said, through the Ministry of Health, we will continue to provide support to this very important issue. And it's not only because the theme for this year has been depression, let's talk about it, that we are trying to create all this hype. I think this hype needs to continue. Like I said, we need to be consistent, we need to be persistent in our messaging so that we can save many, many, many lives. And we must ensure that our Fijians do not go through the trauma associated with depression, loss of life, and like I said, life is for living. And I think we need to be we need to be thankful and grateful that we are living, and we are living to see this very, very beautiful morning, and we need to make sure that we get others to live the life that we want them to live. Okay? So with these words, ladies and gentlemen, it gives me great pleasure to declare your National Symposium on Suicide Prevention open for discussions, and have a blessed 2 days of workshop, and thank you very much for being here.
Was a multi-stakeholders effort to address. As such, I would like to take this opportunity to welcome key partners in this fight against suicide, namely Services Pacific, Empower Pacific, Fiji Women's Crisis Center, Fiji Police Force, and others who have partnered with us in this fight. With this presentation of the national statistics to our colleagues at the Fiji Police Force, I am certain the 2017 World Health Day theme is Depression, Let's Talk. And the national campaign slogan for suicide prevention is Life is for Living. Today we are gathered here to talk about talking about it, whether it is depression or vulnerability to suicide. Talking is the first step with the primary objective of developing a multi-stakeholder action framework which will guide our work in the area of suicide prevention.